the Pixel, where today we're going to be cracking through cardiac murmurs. So let's go. When we're talking about murmurs, we're talking about valves, and valves are very important in ensuring the unidirectional blood flow of the blood through the heart. And we have four valves. We have the pulmonary valve, the tricuspid valve, the aortic valve, and lastly, the mitral valve. When we use our stethoscopes to listen in, we hear two sounds. The first sound that we hear is the lub sound, which is the closure of the mitral and tricuspid valve in the systolic phase, or the start of the systolic phase to be more precise. The second heart sound is the dub sound, which is the closure of the aortic and pulmonary valve in the start of the diastolic phase, or rather the end of the systolic phase. Now, when it comes to valve disorders, there are two main valve disorders we need to know. The first one is the one that produces the classic ejection systolic murmur that can be heard in all four regions of the heart and is most loudly and most profoundly heard in the aortic region, and that's really aortic stenosis. The classic symptoms of shortness of breath, syncope, and angina tend to always present, and the gold standard investigation, not only for aortic stenosis but every valvular disorder, is an echocardiogram. If a patient is frail, elderly, then they would need medical management, but in a more able-bodied patient and a younger patient, a mechanical valve replacement can be offered. The second type of systolic murmur, or murmur as a whole, that we need to pay attention to is the pansystolic murmur that's most profoundly heard in the mitral valve region, which marks mitral regurgitation, often caused as a result of long-term damage to the heart, either through an acute MI, endocarditis, rheumatic fever, or simply ischemic heart disease. It's mainly asymptomatic and often found incidentally, but if severe can produce profound heart failure. And once again, an echocardiogram is necessary. And that's really it. That's murmurs for you in a nutshell. And until next time, guys, see you later.